Been working in pelvic health for a little bit now, and a lot of the things Lindsay had said really resonated about, taking those weekend courses or kind of crash courses. So that's what I did, and I've been kind of trying to piece that all together through mentorship and experience ever since. And this just really seemed like something that would help to bring all of that knowledge together. And also it dives into the colorectal side of things, which I was looking into taking some courses there. Anyway, so I'm very excited. I'm interested in all sorts of populations, but particular interest in pregnancy and postpartum, especially being 18 months postpartum myself. But yeah, I'm very excited to get going with the course.
Hi everyone, my name is Corinne. I'm located in Jersey City, New Jersey. I would like to specialize in pre and postnatal as well as other conditions like PCOS and endometriosis. The reason I took this course is I've had lots of friends and family who have done pelvic floor therapy, pretty much postnatal for the most part. And my favorite food is Italian food. Specifically, I love spicy rigatoni.
My name is Melissa. I live in Naperville, Illinois, which is a western suburb of Chicago. The population that I'm hoping to specialize with is postpartum women, and I currently work with geriatrics in home health. So the reason that I took the course, or that I'm taking the course in pelvic floor therapy, is to learn all there is to learn, because I really don't know anything right now, and then kind of decide where I want to go. If I want to stay with geriatrics and work with incontinence, or if I do kind of want to go into the postpartum world. So we'll see. And my favorite color is yellow.
Hi, I'm Jordan, and I'm an OT in the Midwest. I'm hoping to specialize with the pregnancy and postpartum population, with an emphasis on being able to support individuals who've experienced birth trauma or chronic stress, things with their nervous system that impact pelvic floor function and recovery. So that, and I took level 1 in part because it's from the OT perspective. I also like the inclusion of colorectal conditions, and yeah, being with a cohort and just kind of the accountability to see this dream through with wanting to support these individuals. And lastly, I really like eating salmon and avocado.
Hi, my name is Wynette Sinclair. I know it's a tough name. I live right outside of Charlotte in North Carolina, and I hope to specialize in women, specifically like maternal care. I am taking this because I have taken other courses, a lot of hormone wellness. I'm so excited to take something with a really strong OT perspective, and I'm hoping to really become a much better practitioner than I am. And I have lots of different colors that I like. However, I'm a big foodie. I'm a very gifted eater, to be honest. It's a talent, and I'm really good at it. And I'd have to say, it's tough to narrow down my favorite food because I like so much, but I'm gonna go with Mexican. And I'm excited to be in this class and to work with everybody.
Hi, my name is Keely Earp, and I am from Manhattan, Kansas. Currently, I work as an outpatient OT where I see pediatrics and geriatrics and everything in between, where we work with neurological, developmental, and orthopedic conditions. So right now, I'm not necessarily looking to specialize in any one thing. I would like kind of some good general information, and then I'll go from there. And the reason I'm taking this course is because I've always been interested in it. During OT school, I took a Herman and Wallace course. I was the only OT, let alone student, in there. So I was a little bit overwhelmed, and I told myself I'd come back to it. Had my first baby 6 months ago, so now I'm ready to dive back in. My favorite color is purple, and as for food, I definitely have to say sandwiches. There's just so many different ways you can dress them up, and yeah, enjoy them in every single way.
Hi everybody, my name is Tanya Sharon. I live in Chandler, Arizona, and I work at A.T. Still University and teach in the occupational therapy department. I am really excited to start the level 1 pelvic floor class, and as a yoga therapist, I feel like this will really align well with my past teaching and help me be the best pelvic floor therapist I can be. Can't wait to meet everybody, and my favorite color is purple.
Hi everybody. everybody. My name is Abby. I am an occupational therapist and a lactation consultant. I live in northern Canada, up near the Alaskan region. I live in Yellowknife, Northwest Territories. I work in the perinatal contexts, supporting moms and babies, and therefore I'm really excited to dive into this pelvic health course, as that is such a significant area of concern for this population. And my favorite color is orange, and I'm looking forward to meeting everybody.
Hi, my name is Megan. I'm from Alberta, Canada. The population that I hope to work with following this course is with postpartum moms, but I also have interests in other populations as well and would be interested in trying anything. I took this course primarily because I had previously taken a course that was much more PT focused and didn't really give me much confidence in practicing within an OT realm in pelvic health. So I'm very excited that this is taught by an OT in an OT lens. And my favorite color is green. I'm very excited to meet you all and start learning with you. Thanks so much.
Welcome everyone to our level 1 call. This week's one is phenomenal. It wraps up so many amazing nuggets that we've been learning. So I'm so excited you all are here. So first things first, we only need 3 volunteers and we don't have any. And it's a really important part to volunteer because the whole purpose of today's call is interactivity. And so the first thing I want to say is, let me go through the paperwork and what we're referencing. And then I'm just going to ask if anybody is interested in volunteering. And if not, we'll get creative and figure it out. I will tell you, since 2018, this has never happened. I've never not had a cohort sign up, at least one person. So we'll go with it and we'll be really creative, and we're gonna roll up our sleeves and have a really meaningful call. But I'm really hoping, because the whole point is I'm the OT, I am the client, you are the pelvic health OT, and we learn so much by watching the interaction and the sort of the questions the client has, the doubt they have, the passion they have. So it's a special call. So I hope we can work it out. Okay, so in terms of the paperwork and how we're doing this, in the course platform, has everyone seen where the paperwork is? What you'll see is a 1-page eval followed by 3 different intake forms: client A, client B, and client C. Has everyone seen that inside the course platform? Okay. Has anyone not seen it? Because we have a really small call here, so I'm happy to problem solve with you guys. Catherine and Alina, you guys both didn't see it? Okay, so if you go, I can't screen share since we're within the course platform itself, but if you go into the course and under momentum calls, which is towards the bottom, click on today's call. I believe it's momentum call 3. It has the date March 5th. Once you click on that, in the body that shows up, you'll see the intake paperwork, and then you'll see client A, B, and C. Let me know if you guys find it and if anyone else needs help finding it. Because even if you don't volunteer, having that paperwork in front of you is going to help make this a really active experience for your learning. Okay, so I'll repeat. So basically, go into the course platform under level 1, OT Pioneers, not the Elevate, OT Pioneers, and then click on Momentum Call, which I believe is like under lesson 12. Click on the momentum calls. Once you click on the momentum calls and you see all the calls lining up, click on the one that says March 5th, today's date. I believe it's call number 3. Once you click on that, the paperwork should be very obvious. Catherine, Alina, were you able to find it? Awesome. Anyone else need help finding the paperwork today? Take your time, Angela. Interrupt us anytime if you need some help.
Ms. Lindsay?
Yeah.
It says like table of content for like level 1 pelvic health case study.
Today's should be under March 5th. Let me bring it up. Sorry, let me go in myself here. I can't see you right now because I'm going into the course, but you guys can keep talking. That's totally fine.
It's momentum call number 4.
Momentum call number 4. Thank you.
I see it. Yes, ma'am. Thank you.
Okay, awesome. Sorry that me saying level 3 or call 3 probably threw you off, Alina.
I see it. Yes, ma'am. No, I see
Perfect. And so you guys see the paperwork under call number 4. It's called the intake interview, March 5th. And the pelvic floor intake is a 1-pager, and it's great for all of us, for all 3 clients. And then client A, B, and C is where it's different. That's the 3 different ones. Perfect. Angela found it and she's printing. Awesome. Okay, good. I think we're all on the same page, which is awesome. So everybody, let's start off by taking a look at the 1-pager. The 1-pager says the pelvic health eval. That's just going to be the same for all 3 clients. So familiarize yourself with that. I tried to make it kind of short and sweet so that we're not spending a whole lot of time with the medical history. And then take a look at the pelvic floor questionnaire. This is the Australian pelvic floor questionnaire. And we're going to start with client A. And so basically, as the pelvic health OT, you are looking it over, right? You're kind of getting a sense for the data that you can glean from this. One of the questions I think is the most important is the very last question in each section. So question number 15 is the first one. That says, how much does your bladder problem bother you? That tells you a lot of information. Then if you go into the bowel function section, question 27 is the exact same thing. How much does this bowel problem bother you? And so on. But take a quick moment to kind of look it over. Usually when we have volunteers for this, they've already done this. They've already looked it over. And so we're able to just use our hour together, really getting into the meat of it. Because no one volunteered, we'll just kind of do this a little bit differently, give you guys a moment to kind of get familiar with the paperwork. And then, would anyone like to volunteer today? So how about for this first one, we do it as a group think. We'll kind of answer questions together. And then if someone would consider volunteering for B or C, that would be wonderful, because now you've seen how it was run. And that way you'll kind of get the full interaction. It's kind of like being a fly on a wall in a treatment room. Like, it's just really cool to kind of see just one person going back and forth. And I'm able to kind of like take on a identity, if you will, of what a client would act like. So let's try to go for that. For this very first one, I will still be the client, and you all collectively will be the pelvic health occupational therapist. So I'll give you guys just another minute or so here to go through the paperwork. And basically ask yourself, what do you want to know more about? What is standing out to you? And recognizing that the intake paperwork is just the beginning. It's the entry point into you understanding what the client is experiencing, but then the conversation that ensues is where we get most of the meaningful data, because paperwork doesn't say it all, right? Okay, for the sake of time, let's go ahead and get started. So, here I am in your office. It's the evaluation. You've looked over the paperwork, and I'm sitting across from you. Does anyone have any questions they want to ask me?
First thing I would say is, okay, so let's talk about why you're here. What's something that's been troubling you, or something that you'd like to address first and foremost?
Yeah, thank you so much. I'm excited to be here. I've been dying to come to pelvic floor therapy ever since my sister went through it, and she spoke really amazing things about it. For me, the thing that really is on my mind that bothers me is my stooling. It is, I am hardly going. And when I do, it is such a challenging experience. I'm also really embarrassed because I am a nurse and I'm around people all day long, and I feel like I'm always leaking gas. So I'm really hoping that you can help me.
Okay, thank you for sharing that with me. I do wonder, whenever you are experiencing this, you mentioned that you're having a challenging experience whenever you're having bowel movements. Are you experiencing pain? And if you are experiencing pain or difficulty with actually eliminating, where are you feeling that sensation in your body?
Yeah, that's a really good question. I am feeling it in it's like a lot of pressure in my lower abdominal area. And then when I sit down to go, it just won't come out. Like it will not come out. It feels like something is stuck there. And it's just really uncomfortable. And I feel so bloated all the time.
And when you are able to be successful, does it feel like you're having like rock hard stool? Is it loose? Like where do you feel like it is on that scale?
Yeah, that's a great question. It's really hard and it looks like little rabbit pellets.
Okay. And then you were saying that you're having difficulty, you're rarely going. How often do you think that you're having a successful bowel movement?
Less than one time a week.
Okay. If anybody else wants to jump in, please, gosh, jump in.
Yeah, I would also ask, is there anything that has seemed to help or the opposite, things that you've noticed have made this worse over the past couple, like while you've been thinking about this and trying to make changes, what seemed to have been good for you and what seemed to have maybe hurt it a little bit more?
On days when I'm not working, it's better. I work 4 days at the hospital. And when I'm not there, it's so much better. And so I do a lot of night shift work, but it changes. And on those days when I'm home, I go in the morning and I'm like, wow, why can't I do this when I'm at work? So I would say that's been the best. Also, sometimes like with the food I eat, I think like it changes. When I'm at work, I'm heating up meals. I'm eating cafeteria food. When I'm home, my partner, she is such a good cook. She is making food for me all the time. And I feel like it's better on those days too.
So it sounds like routine has a big part in how you're feeling in general.
Yeah.
Or your routine at work. Has there been anything that you've tried to bring from your routine at home? I know it can be difficult because, I mean, historically, and nurses have, you don't have a second to think, you don't have a second to breathe, you're working. But has there been anything that you've tried to bring from that home routine to your work routine at all so far?
No, but if that's something you can help me with, that sounds amazing.
Cool.
I'm also curious with your work schedule, what's your water intake like throughout the day?
Yeah. I definitely don't drink when I'm at work. There's a lot of reasons. One time I saw one of my patients drinking my water bottle and that like really grossed me out. And, I kind of am a little bit haphazard with my water bottle. Sometimes I leave it like on my desk. Sometimes I leave it like in different places. And so I've just given up between those factors. Like I'm not really drinking at all.
Okay. That's very good to know. And when you're at home, are you, also drinking water throughout the day? Do you use a water bottle? What's your home routine like when it comes to
I do love coffee. So I drink a lot of coffee, both at home and at work. And then I'll do a lot of sparkling water. I have one of those SodaStream things, like I'll put different flavors in it. So I do a lot of carbonated beverages. And then sometimes when I start a shift, I'll do like one of those energy drinks.
One thing I would be curious about to ask is what brought you in to see me now? And what I'm interested is, have your symptoms that you've outlined, thank you, in the questionnaire, are these more urgent than they used to be beforehand? So I'd be curious about what your baseline or what your bowel movement history was like prior to you coming and seeking help here.
Yeah, I'd have to think about that. That's such a good question. But I would say, so I had my first kid via C-section in 2012. Then I had a VBAC in 2014. And I would say it was really after the C-section that things changed a lot for me. That was 14 years ago. So it's hard for me to remember exactly, but that seems clear to me. I remember a shift happening there for me. And I should also mention that like when I wear certain pants, it does not feel good on my stomach where the C-section happened. So I noticed that I'm just like avoiding high, waist, low waist things. I do a lot of like upper waist. I do like things that like have buttons so I can kind of feel some release during the day. My scrubs feel good. But yeah.
Lindsay, can I jump in? Can you hear me?
Go ahead, Angela.
So I am wondering a couple of things. I just wanted to jump back. worked with any other providers or talked to anybody from your primary care to nutritionist or other therapists?
No, I haven't spoken with anyone. Like I said, my sister went to pelvic floor therapy and she just spoke so highly of you. And so that's why I'm here. You were my first stop.
Great. And then I wanted to ask a little bit more about, I see that you have some low back pain. Can you tell me a little more? Was that pre-babies? When did that start?
Yeah, I would say that's been a lot more intense the last couple years as the constipation's gotten worse. I have no idea if that's related, but that has definitely been a connection that I've noticed.
Thank you.
You guys are doing awesome. I kind
You
of like
don't
this.
hear me.
I kind of like this group think thing.
Can you hear me?
Yes. Hey, Teresa.
Okay. Hi. I am also wondering, we talked a bit about your work and what goes on, your work. We know that your schedule's kind of packed there, but I'm wondering about other things, like what your general lifestyle is like and your routine outside of work.
Mm-hmm.
If
Yeah.
you can tell me a little bit about that.
Yeah. So for me, I love to run. I'm a big runner. I try to run a couple days a week. On my weekend, I'm definitely running. On days when I don't go before I run, I'm not going as far. I've noticed that. Like I just don't have as much energy, but I'm still trying to run. On those days, I am really, really thirsty. So I'm thinking I should really try to drink more water on those days that I run. I also really love knitting. I think that really helps me relax a lot. I try to do that at the end of every shift. So that's really fun. And then my girlfriend and I love to go out dancing.
And I'm sorry, did you say how often you're running?
About 3 days a week on my off days.
Okay. And I'm wondering with the different kinds of activities, if anything changes about the bowel movements or it really just sort of stays at that about one time a week.
That's a great question. I really am glad you asked me that. I will pay attention to that this week and let you know because I'm starting to see as we're talking, there's so much about my patterns and my routines that are making a big difference with my symptoms. So I'll pay attention to that this week.
And then Lindsay, I know you're here specifically for your stool, but I'm also curious, what are your bladder movements like?
Mm-hmm. Yeah, great. So typically I will go before any shift starts. Also before I leave the house, it just makes sense to me to do that. It feels good to empty my bladder. Cause sometimes I feel like when I haven't gone to the bathroom, it's been 6-7 days that I have to pee so bad all the time, and I don't know if those things are connected, but boy, do I feel that. And I would definitely say that there's to start my stream, I can't just sit down like I used to. I have to almost feel like I'm having a bowel movement to get it started. It's not quite straining, but I don't know. It requires a lot of effort for me to start my urine stream.
Okay. And then since you started having these difficulty with bowel movements and difficulty with urine stream, have you also noticed any changes in sexual function? Any pelvic pain, anything when you're difficulty with arousal, any lubrication changes?
Yeah, I just don't really feel much sensation, honestly. I feel like I'm adequately lubricated, but I just don't feel a lot of sensation there when we're having sex.
Okay. And when you are having sex, is it typically for clitoral stimulation, penetration? Where do you enjoy having that sensation whenever you're being intimate?
I really enjoy clitoral. I would say after my VBAC, it just hasn't felt the same, and lower.
Okay. Have you and your partner tried any changes with sensation, like adding toys into your routine or anything that can add vibration or softness or hardness, anything like that?
No, but I would definitely love to learn more about that.
Okay, great.
I would be curious to know if she has feeling when she having a bowel movement then. Is she feeling the urge or is that missing?
Good question, Catherine.
And also, when you do need to pee, I'm also curious, when you do need to pee or have a bowel movement, do you have enough time to get to the toilet? Do you feel like it's an urgency that's coming in quickly, or do you feel like, oh, I have enough time to leisurely make my way to the bathroom?
I'd say it's hit or miss, but I would say more often than not, it does feel very urgent.
Lindsay, I'm going to jump around again.
Good.
And I'm a big part of what we like to do is teach you some things you can implement in your everyday life and some exercises. And I do like to start that the first day, but it needs to be something that's realistic for your schedule. How much time might be 5 minutes or 15 minutes or half an hour? Ultimately, how much time do you think you could take out of your day each day to dedicate to yourself?
Wow, I've never been asked that before. That's great because I don't like to do home exercise programs. I'm notorious for that. I'm sorry, as a nurse, that's just the way it is. Realistically, I could probably do a routine before I run. So I'm already setting aside that time that I'm running 3 days a week. I could probably do like 10 or 15 minutes before that, if that works.
That's great. And know that you're not alone in that. That's pretty common for almost everybody.
Awesome. All right, let's pause here. You all did incredible, really incredible. And I want to point out a few things, and I apologize if I didn't write everybody down. It's usually easier when it's one person and I give like a nice long list of things. I'm going to start saying the things that I wrote down. If anyone has anything in particular they want to put in the chat, because there was so much bravery here, so much beautiful thoughts captured, go ahead and put some love in the chat for your coworkers here, your colleagues, because this is really good clinical reasoning that you deserve a huge round of applause for. So right off the bat, I think Samantha started us, right? So kudos for the bravery on that. I really loved the way when you asked me questions, the way you said, okay. I know that sounds like such a small thing, but go back in and watch this video. It was just so reassuring. I didn't feel judged. I mean, I didn't feel judged from any of you, but Samantha kicked us off, and I really felt that from her. I love that she went into bladder. I told you guys right away that bowel movement was my issue, but you guys know we have to bring in every part of the pelvic floor. So she not only did that with bladder, she did that with sex. I love that she asked me clit versus penetrative preferences. That is very important because not everybody has sex one way. And so we really need to be incredibly open-minded and put it in their court and learn what they like. And then she even brought in like toys and the sensory system, vibration, textures. Like she really went there. And so that was fantastic. Jamie, I loved your questions. Your line of questioning got us going in such a great way. And then you started talking about the routine at home in particular. And that was really an important piece to this that I really appreciate. Abigail, why now? That sense of timeliness that you brought in is so key because most of our clients have been dealing with this, except our postpartum clients and some other exceptions. Most of our clients, this has been put on their back burner for so long that it really is a very crucial question to try to figure out why now. And why now lets us know something has changed. Maybe it's internal motivation, being sick of it. Sometimes it's just that simple, but sometimes it's something else. And that is a key thing to get at because that's the change that we're probably going to need to address. Angela, I loved how you asked me what providers have I worked with. That gives us such a history regarding what I've tried, gives you, lets you know what other providers I've worked with. Do I have a nutritionist? Do I have where are my priorities? Where have I invested in myself? And then it also links to referrals, which is great. You were the one to bring in low back pain. Really appreciate that. And then my favorite question you asked was the realistic time frame for the home exercise program. That's one of my very favorite things to do. I think that is one of the differentiating factors in occupational therapy, and it's genius. And you then reassured me. The way you reassured me, you are not alone. I just felt so good, right? Because most people feel so guilty about that. Teresa, routine outside of work. Maybe those are two different things. But you said something about what's my routine? Oh, outside of work, what do I do? What brings me joy? What are my hobbies? So important. And then I think you wove in something about any changes that I might be experiencing with my symptoms based on that. And then Catherine brought up the connection. If I'm not feeling anything in penetration, is it possible that there's any carryover with my main symptom of bowel movements? Is the urge missing? And is the sensation missing there? So you all did incredible. I apologize if there's someone I missed. Everybody was just on point and phenomenal. And there's really nothing else that I want to bring to your attention except for the fact of under sex on the second page where it says question 43, how much do these problems bother you? She said, I don't have a problem, but yet she is having no sensation. That's a bit of a red flag to me. She may have misread the paperwork. That happens. But I'm always at a disconnect if someone has an issue, something they're experiencing, and they say it doesn't bother them. One of the very first things I do in all of the Australian Pelvic Floor Questionnaire is look at that last question in every category to see where their priority is. It's very clear. Bladder is only slightly, bowel movement is greatly, prolapse is not at all. And then sexuality, not at all. And it's like, okay, she's here for her bowel movement. We're going to ask her, but right, you're starting to form a clinical impression of your client before they walk in the door. And then you're noticing, well, why wouldn't this bother you? You know, and then you'll kind of find out more about what's happening in their life. I think that's the only thing that I wanted to bring to your attention. You guys were incredible. That was really phenomenal. Does anyone have any thoughts or questions that they want to share about this case? Okay, let's move on to client B. Would anyone like to volunteer to be my therapist? All right, let's just keep going with our group think thing then. I think that's really wonderful. And you guys will just forgive me if I don't write down your name and something amazing you did, because it's so hard to like be the character and be present and remember everything. So I just want you all to know how much I appreciate all of your clinical reasoning and your bravery.
I actually had a question, Lindsay, about
Yeah,
the
of
first
course.
one, just quickly.
Yeah.
I'm wondering, obviously knowing that you will have the questionnaire submitted in advance and you'll do a review of that questionnaire.
Yeah.
I don't know if this is tricky to answer, but I guess, do you spend a good amount of time like reviewing the answers of the questionnaire, or is it that you do sort of a clinical analysis of the questionnaire and then focus on if there's something that comes up that you're like, I'm wondering about this, you'll go right there? I know your initials are 90 minutes usually, you said, right?
Mhm.
Mhm.
Yeah. So if a client is going to take the time to fill out their paperwork, we want to equally respect that, right? Like it's a big deal to fill out paperwork. And also this is very minimal paperwork. You know, you guys maybe have familiarized yourself with the section in the course where I showed a bunch of different type of paperwork. At the Functional Pelvis, I have very elaborate paperwork. And so I'm never going to not read it, because I think I really want to respect the client and the time they put in. Plus, it really does jumpstart the conversation so much. Like you're not starting from scratch. Now, that doesn't mean that we're not clinically present and hearing new things they say. I'm not reading the paperwork assuming anything. I'm just kind of curious. I'm bringing a lot of curiosity to the table. I'm paying attention to what they wrote me in the paperwork, and then I'm being really present, and I'm allowing that to have guiding questions. So it might seem overwhelming a little bit, Abigail, and everyone to think, oh, like this is a lot of like time and everything. You get really fast and really good at it. And it becomes, especially if you're always using the same questionnaire, and I highly recommend you use the Australian Pelvic Floor Questionnaire. I think it's just such a nice overview. You'll get good at it. You'll get really good at it, but always balance what they've written with what they're sharing with you. And as OTs, we do this really naturally, but it feels relevant to mention that. Does that help, Abigail? Do you have any like follow-up questions to that?
No, that helps. Thanks.
Okay. You'll get really good at it, really fast at it. Okay, so let's go to client B. If you need a minute to familiarize yourself with the paperwork, we'll take a quick minute to do that. But as you also saw, as some of you jump in, like we can continue to look at it together and everything. So, but I'll be quiet for a minute as you guys look it over. All right, let's get started. Who has the first question?
I can jump in to start if no one else wants to.
I have a quick intro question. This isn't a question I'd ask a client, but how old is this client?
Yeah, that's a great question. So it should be on there. Her birth date
Oh,
is
sorry.
1980, so she's 46.
Okay, thank you.
Yeah, no worries.
Okay. Okay, Lindsay, thank you so much for coming in today. I've been taking a look through some of your paperwork, and I'd love to hear a little bit more about what brings you in today.
Yeah. Thank you. Yeah, so I work from home. I'm an administrative assistant, and I hate my boss. I absolutely cannot stand my boss. It has been horrible since COVID. So in COVID, we were working in the office, and then he's such a cheapskate that we went home. I wasn't bothered by that, but we haven't gone back. And ever since this, I have had these problems with my bladder that basically I just have to go all the time. I'm going all the time. And the biggest reason for this is really him, because he thinks that I'm not working. And I feel like I can't leave my desk. If I leave my desk at all, he sends me a message. Hey, why aren't you at your desk? You know, because we're on calls all day long. And so this is like such a source of stress for me. I need this job. I'm the sole breadwinner at home. But this has been really challenging for me.
Oh, I'm sorry to hear that. That sounds really stressful. Have you worked with any other practitioners, talked about your bladder issues with anybody else since they've been going on?
Yeah, I went to my urologist, and they ran some tests. They said everything was fine. I didn't have any issues. I saw your card at the checkout when I left. They didn't say anything about you, but I saw the card, and I said, I don't think that's it. I think there's more here.
Yeah, you're definitely right, and you're in the right place, because we can definitely help you. Oh, I just lost my train of thought on my next question. I want to pause if somebody else wants to jump in.
I was going to say, you want a popcorn?
I always like my first question is tell me like a little bit about what brought you in today.
Yeah. Okay. Sorry, I'm trying to take notes as I'm playing my character.
No, you're fine.
Yeah, I mean, really, it's this peeing situation because I am wearing pads because I might sometimes just pee right there. And it sounds horrible. I'm so embarrassed to tell this to you, but like if I can't leave my desk, sometimes I'll just pee right there. And so I've got these pads on and I do that. And so really like I feel like I want to solve this, but I'm between a rock and a hard place.
Understood. And so just to clarify one thing, I know you mentioned that you have a very hard time getting up from your workstation.
Mm-hmm.
Do you feel like if that wouldn't be an issue, if you could get up whenever you'd like, have full access to a bathroom, how often would you say you're having a urinating? Because I noticed on your intake form that you've listed that you're urinating between 11 to 15 times a day. But I just wanted to confirm that, considering you're saying now you sometimes feel like you don't have access to the bathroom.
So I often don't feel like I have access to the bathroom, but I'll go because it's so urgent. So I'm scared. So sometimes I'll pee in my pads, and then other times, especially like if his camera is off, I'll go. Also, I'm going about that much when I'm not at work. That's like now the new normal for me.
And do you ever feel like well, tell me a little bit about that urge to pee. Does it come on suddenly? Do you feel a gradual buildup? How would you describe that?
Yeah, I would say it comes on pretty suddenly. Like it kind of takes me by surprise. But now, because it's been happening for so long, I kind of expect it. Like it is now my body and it's what I do. But in the beginning, it felt so sudden and like abrupt.
And if it is kind of those moments with the boss isn't around, you can't go to the bathroom, do you still feel worried that you're going to have an accident in the pad?
That's a really good question. I'll pay attention to that this week. I don't know.
Okay.
Lindsay, do you have scheduled break times, which should be the law?
It's a good question. No, I don't.
You might want to speak to HR about that.
Sorry, I didn't have my chat open. Let me just look at the chat really fast. Oh, cool. You guys had some great love in there for everybody. Yeah, exactly, Teresa. These may not be it's second nature to us, but not always is the case. That's excellent. Teresa, you got to go. I understand. Thank you for being here.
I am curious, whenever you are having, when you're using the pad to urinate, are you able to go clean yourself up promptly, or do you have to sit in it a while because you're on the call with your boss?
Yeah, I have to sit there.
Have you noticed any different smell changes or discharge or anything like that since you started using pads?
I'm a lot drier down there. And I thought maybe that was menopause. I don't know if there's a connection here, but I have noticed I'm like itchy down there now.
Okay. And when you are peeing either in your own comfort or at your desk, do you ever feel like you're fully emptying?
No, I always feel like there's more there.
Okay.
Lindsay, can I ask, you mentioned this sort of started when you guys transitioned to working at home during COVID and sort of after that. I see that you have 2 babies. How old are your kids now?
14 and 12.
Oh my gosh. So a C-section and then a VBAC.
Correct.
Any issues after your pregnancies?
Great question. Yeah. I would say that sex has not been the same. This doesn't bother me. I don't really mind, but I just don't want to have sex ever since I had my kids. I just don't have the desire. It sometimes feels like he can't fit in, you know?
Mm-hmm.
So yeah, it's fine.
Okay. Okay. And then I see that you have a history of some back pain as well. Where does that sort of fit into the history here?
Yeah, I'd say it's been because I'm sitting at my desk so much since after COVID. Like I used to, back when we were in the office, I was like so social. I was walking around all the time, you know, and like I didn't have that pressure. It was clear I was working. You know, I didn't know I just think my boss thinks I'm not actually like working or something. So anyway, I would walk around all the time and I don't feel like I'm stretching my legs at all. I'm always locked in bed.
Yeah. That must be really frustrating, I'm sure.
Yeah.
So the days that you're not working, do you have the same urgency to go to the bathroom?
Who was that?
Nancy.
That's a good question. I think so. It's starting to really carry over. It's starting to really now be my new normal.
Okay. So your fluid intake on the days that you work and the days that you don't are about the same?
Yeah, I would say it's about the same.
Okay. Have you tried any alternative seating when you're working, like a desk that would allow you to stand up, or a therapy ball, or a modified chair?
No, I haven't thought about any of that stuff. That's great.
Lindsay, I would like to know a little bit about your bowel movement as well. How does that look like for you?
Yeah, I probably go like every 4 days, something like this. But it's like that in my whole family. Like it's not that big of a deal. You know, I definitely like I'm on laxatives, and that helps. So.
Okay.
Hi, Lindsay. It sounds like you have an incredibly stressful like work environment, and sometimes when we have a stressful work environment, it elevates our nervous system, and sometimes when our nervous system is constantly elevated, like it affects our ability to control like bladder and bowels. So I'm really curious about what you do while you're working and when you're not working to like somehow like relieve some of the stress. Like
Who
how
was
do
that?
you cope? I was curious what kind of things are you doing to cope with your stress?
Yeah, good question. Who was that?
Aisha.
Aisha, thank you. Good question. I go for walks. Walks help me a lot when I get off work.
Lindsay, what are something that you like to do? Like what makes for fun, like your hobbies or something that you love to?
I used to do a lot. I just don't feel like doing any of it anymore. I used to roller skate. I used to garden. I love, I live near the beach, so I love going for walks at the beach and going swimming, but I just don't do any of that anymore.
Sorry.
Sorry, I was gonna say, do you feel like the constant need to urinate has kind of kept you from doing a lot of those activities that you like to do?
Yeah, for sure. I think that's a big part of it.
About how, if you had to guesstimate, about, I'm wondering how much time do you have between urinary movements?
Don't worry, you're at work. It's all good. We appreciate you being here. Good question.
So at what point did you find yourself becoming less involved with all of these activities?
It's a good question. Who was that?
Nancy.
Nancy again. I would say probably in the past year is really when I've hit the tipping point. All right, let's take one last question just so we can debrief and have time for the last case.
I have a question. You mentioned, I'm sorry.
That's okay. Go ahead.
You mentioned having pain at the introitus, I guess, and minimal sensation with penetration and not using lubrication. Have you tried using a lubrication? And can you tell me a little bit more about that pain?
What's the introitus?
At the opening of the vagina.
Oh, okay. Have I tried using any lube? I have not. But like I said, I'm really not interested in sex. I really like, it's fun when we do it, but I'm really much more concerned about my urination.
And you also mentioned your bowels having constipation. I don't know if we covered that.
Yeah, we didn't really cover that. And I also said in my intake that doesn't bother me, I think. Yeah, I think she doesn't. Go ahead.
I was going to end the conversation by thanking you for all of the information you've provided. And I also just wanted to ask that if there was one difference in your life that you would like to see as through our time together and working on our goals, what would the difference in your life be? What would the most important thing that you're hoping for out of our sessions together?
Honestly, it's agency. I'd like to feel like I have some control again over my life.
Okay.
Awesome. Phenomenal job. Phenomenal job, everyone. Please put love in the chat. Let everyone know how amazing you all were. I think now we all just have to work together. We need to have every client, like this has to be all 16 of us in every session because we're not the same without each other. This was phenomenal. Okay, let's kick it off with Catherine. No, that was the last note. Sorry. Let's kick it off with Angela. Any issues after pregnancy? She's the first one to bring up the fact that, we have to acknowledge the postpartum journey. I know it's not a new postpartum experience, but that story likely kicked off a lot. Thank you, Jamie, for being here. That story kicked off a lot for her. And so we always have to go back to that. So thank you, Angela, for that. She acknowledged the paperwork. That's huge. I love starting sessions off acknowledging paperwork and saying I read it, I think is specifically what she said. She asked me if I worked with another practitioner, and I loved when she told me that I was in the right place. That is one of the most important things we can say to someone because they don't know. They don't know they're in the right place, and that's so reassuring. Jamie, what brought you in? Love that question. If you could get help, how often, if you could get up, how often would you go? What a phenomenal question. She was trying to tease out the difference between my nervous system and my bodily function, right? With that question. And I love that. I felt like it got right to the heart of it. Catherine asked me about scheduled break time. She got to that HR issue real fast, and that's great because a lot of these people don't know that they have a voice, they can get help, and this person is clearly very buried under that stress. So that was a key question. Samantha, I love that you asked me, do I clean up? Right here I am soaking myself, and that's a key piece of education to let them know that you just don't sit in that, and that's contributing to a lot of vaginal dryness. She asked if I was fully emptying. Great question. And then she made the tie of, do you think it's your constant need to basically perseverate on urination that's affecting my joy and my ability and desire to participate in things? Nancy asked me about fluid intake. Genius question about alternated seating. I said something here, less involved in activities. Oh, what about activities when you're not working? Do you have the same urgency? That's great. Another, need to tease out where work is involved here versus bodily function. Alina brought up bowel movements. Fantastic. I love that you brought that up. And then what would you like to do? She asked me, right? So getting to the heart of some of that anxiety and depression and finding out beyond that. Aisha brought it up, just called it out. Hey, you work in a really stressful environment. Nervous system's impacted here. What do you do to relieve? What's your coping mechanism? Fantastic question. And then Abigail, I love the way you ended it. I love that you thanked me for being so vulnerable. And what a beautiful OT question. What is one difference you would like to see in your life? And sometimes they're going to say the P, but what did she do, right? She brought up a bigger issue, which is the most pervasive thing in her care right now, which is that lack of agency. So that's a beautiful question. Does anyone have any other comments, questions, things they want to bring up about this case? Awesome. Okay, let's move on to client C. Deborah said, you've answered a lot of questions. I'd like to tell you something you've shared that is a challenge, but is a good sign that we can achieve improving your areas of concern. What I noticed is your work has changed your bladder and bowel patterns. This means you can train your body to better serve you through training during our time. I love that, Deborah. Yeah, that's fantastic. Okay, if anyone feels compelled to be the therapist in this, great. If not, I think we'll just keep on going with our group think here. Anybody? All right, cool. So I'll give us a minute just to kind of look it over. Okay, if you guys are ready to get started, I am ready for your first question.
I would ask, where are you coming from right now and how are you feeling? Would you like a cup of tea?
Oh, great.
Relax.
I'll take a cup of tea. Yes. That's great. One of my first mentors in Burlington, Vermont, gave porcelain cups of tea and had rocking chairs in every treatment room with a blanket over the chair. And I loved that.
Was that Jane?
Yeah.
Oh, wow. I love her.
It was Jane. Small world.
She's great.
Yeah, she is great.
I would say, hi, Lindsay. Thanks for coming in today. And thank you for filling out the information on the questionnaire. I wanted to start the session today by acknowledging that the questionnaire covers a number of different areas of pelvic health. And is there an area that you would like to start today?
Oh, yeah. Thank you for asking me that. Really, it's this thing I'm so embarrassed about. I don't know what's going on, Abigail. I have so much pressure down there. And I have a very physical job, and I'm scared because I don't know why I'm feeling so much pressure down there.
Hmm. Yeah, thank you for starting that way. And I totally acknowledge that we're not used to talking about our pelvic health. And so just for me to get a little bit of clarity about what you mean when you say pressure down there, would you be able to tell me with a little bit more detail about what you're feeling? We could start by saying, when you say pressure, can you describe that?
Yeah, so I'm a farmer, and I'm out there all day long, and I pick up really heavy equipment and heavy machinery. And so basically, I would say it gets worse as the day goes on, and I just feel like something is coming out. And I don't yeah, I mean, I went to the doctor. They told me I have something called like prolapse or something. I Googled it. I got really scared. They didn't really tell me much about anything. They just said to come see you. And it's just really scary.
What type of doctor did you speak with that told you about this prolapse?
Who was that asking the question? Who is it? Corinne. I went to my general practitioner.
So, Lindsay, I want to tell you that last week I myself picked up a 50-pound tree and wound up with a grade 2 prolapse, which I have successfully rehabbed in almost 2 weeks. And I think that you're in a really good place to work on that. I understand with your occupation that you probably do things like that all day long, but perhaps we can make accommodations for that and really dive into that diagnosis and treatment to be really helpful. And having gone through it, I know the pain and the pressure and the burning I felt, but it is rehabbable, which as a new pelvic health therapist, I was kind of surprised and thrilled.
Wow. Thank you so much for sharing that with us, Catherine. And I'm so happy for you. That will give you such invigoration as you continue to, be in this career. And as a client, I would say, wow, thank you. I'm not the only one here experiencing that. And that makes me feel so much less alone. And the fact that you are seeing changes makes me feel really optimistic that working with you is going to help me as well.
Lindsay, can I ask, is it your own farm or do you work at a farm?
It's my family farm.
Oh, wow. And I see that, the prolapse, number one, I want to just reassure you, prolapse is a very common issue, and there's a lot of things we can do conservatively to treat it and to help. And a big, huge part of that is going to be education and helping you understand more. I also see from your intake form that you're not currently sexually active because of some embarrassment about your prolapse, which is also a very common experience. Do you have a partner at home?
I do. Yeah. Yeah. We have been married for 15 years, and I just feel like I smell. I feel so gross. And so I just told him, don't even come near me. So we're sleeping in different bedrooms now.
I'm really sorry to hear that. But know that it's really common, and there's so much that we can do. You're definitely in the right place here. I see that you also have a couple of children. You've had a couple of C-section and a VBAC.
Yeah,
Can
exactly.
you tell me a little bit about your experiences during pregnancy and postpartum?
Yeah, I'd say both are pretty non-eventful. I was really disappointed that I had a C-section. That wasn't in my plan of care. No one else in my family has had a C-section. But I would say that around that time is really when the heaviness kind of started. Probably I had it before I had children, but I think continuing to work up until the day I gave birth, lifting heavy things, probably just was a cascade of the perfect storm. And now I'm still doing that. And so I would say it's gotten worse, since the birth of my first baby 14 years ago.
Okay. And then I see that you have some low back pain as well. Can you tell me a little bit more about that?
Yeah, I've always had that. That's not new. I think it just kind of comes with the territory of the type of work I do. I just have some things I do where I wear like a brace. My partner will massage it. I'll put icy hot on it, that kind of stuff.
Okay. And then as far as the sort of really physical duties around the farm, it sounds like does your partner work on the farm as well?
Yeah. Mm-hmm.
And what who else is there that can do some of the physical stuff? I know when it's your own farm, right? There's really this obligation, like stuff has to happen.
Yeah.
But can you tell me a little more about who can share some of those duties?
Right now we have a part-time employee, and he comes in a couple days a week, and he's going to school. So he can't expand his hours, but it's really helpful. So really, it's just me and my husband.
Okay. Okay. Great. Great. Lost my train of thought.
Also, what exactly is she doing? What kinds of activities on the farm? And
Yeah.
also what activities outside of work?
Yeah. Good question, Catherine.
And when you're not working, do you still have the same level of heaviness?
Was that you, Nancy?
Yes.
I'm finally getting your voice.
It takes a while to get in this train of thinking.
Yeah, it does. But isn't it great? Like that's why I love these calls, and you could see why. Like, it's just one of these things. We could do this for hours, and I think we just light bulbs go off. Like, it's so helpful. It's fun. We're playing detective.
Lindsay, I'd like to jump in and just ask are you comfortable talking about the bowel side of things?
Good. Who was that?
Elizabeth.
Elizabeth.
The bowel piece can actually have quite an influence on prolapse, and so it's worthwhile investigating that together if you're comfortable with it.
That's awesome. That's awesome. Just for the sake of time, I'm not going to answer these questions, just to kind of keep you guys going through your clinical reasoning.
Lindsay, I also wanted to ask, following back up with the farm work, is it a 7-day-a-week job when you own the farm? I have not ever owned a farm, so I don't know.
Yeah, it's 7 days a week, nonstop.
Yeah.
And Lindsay, I know that medical terms like prolapse can sound really scary, but can you tell me what you understand that term to mean?
Okay, I am going to answer that question because that's a really good one that we should be asking our clients. I really think that my bladder is just literally coming out. And sometimes I see it, it's pink, and I literally think my body is collapsing from the inside out. That's what it feels like. That's what it looks like. Yeah.
Lindsay, has that limited your fluid intake since you said you feel something is coming out, something is like, the pressure down there? How's your fluid intake?
Yeah, I've never been a big water drinker. I just, it's hard. When I'm out on the farm all day, I don't really know how to keep up with that. Probably at the end of the day, I'm chugging, I probably have like a big bottle that I'm just sitting there catching up. But I'm really not. I chew gum a lot. That kind of like hydrates my mouth. That's about it.
How has
Go ahead.
oh,
Go ahead.
sorry. How has this feeling of pressure affected your ability to do your tasks and duties on the farm?
Who was that?
Aisha.
Oh, Aisha, thank you. Great question. Yeah. So sometimes I'll just so typically, I'm not coming in to go to the bathroom. So I'll just pop a squat essentially on the farm. And so I notice that I'm just doing that all the time now, ever since the heaviness has increased. I'm peeing all the time while I'm out there. Is that okay?
I'd also like to know what kind of equipment are you driving? Because it can be very bouncy and bumpy and be very irritating.
Good question.
If it's okay, I'd like to circle back for a second and just address your concerns about the way you described your fears surrounding the prolapse, that you were worried that your bladder is falling out. And I just want to reassure you that your organs won't fall out. The bladder won't fall out. It is just that the bladder and the vaginal wall are pressing against one another. And so there's just some weakness, some tissue changes in the vaginal wall that allow for that sensation of bulging in the bladder. And so you don't have to worry about the bladder falling out. Also, you mentioned that you asked about popping the squat. And it makes sense that, when you're out doing farm work, that it's probably hard to get to a bathroom. It's not necessarily convenient by any means, and you don't want to have to stop what you're doing. I would say it's not necessarily the best for releasing the urine, because of the fact that it when you're squatting down, you're engaging all of those muscles. And so it can actually work against you a little bit physiologically. So, but we'll talk about, some alternatives and maybe ways that you can still manage to get to the bathroom, even in the face of the farming challenges.
Thank you, Elizabeth. Awesome. All right, let's take one last question so we can do our wrap up here. And I apologize, we've gone over today. Thank you for sticking with me.
Is there anything that makes it feel better?
Yeah. Excellent. All right. You guys did an incredible job. You can see we kind of did the gambit. We started with bowel, we went to bladder, and we ended up with prolapse. That was amazing. Please show some love in the chat to your amazing colleagues. I'm going to start with Catherine. She kicked us off. And, she said, where are you coming from? Like, can I give you a tea? Like, it's a demarcation of transition. And I think that's so special, coming into a pelvic health session to do that and to acknowledge that and to all of a sudden basically soothe their nervous system the moment they walk in your door. So that was beautiful. Asked me what kind of I can't read my own writing. It was the last thing she said too. What kind of factory or farm outside of work? I don't know what I meant by that. Last week, she shared last week, she picked up a heavy tree. You're in the right place. I love that. I mentioned in the course because I developed a prolapse after my first birth. And I love sharing that. If you're comfortable in it and you don't mind, it is so reassuring for a client to know that their therapist has been through that journey. So I love that she shared that. Anything that makes it feel better. That's a great question. Real insight into roles, habits, and routines that they have found to give themselves relief. Abigail, fantastic. First of all, you're so reassuring. Your clinical use of self is, you have a pace to you. There's just something about you that is incredibly rapport building for me. And you all do. You all are fantastic. Abigail said, we're going to be covering a lot of areas. And I think you then asked me my priority. I loved that. You also said, hey, we're just not used to talking about pelvic health, and I love that. I love just calling out exactly what's going on in a session, because I think it really helps the client feel present and reassured. Also, you asked me, what do I understand about prolapse? That's a question I want you all to ask every single prolapse client you have, because it's an amazing opportunity to myth bust, because there's going to be a lot of myth busting that they'll probably need from you. Corinne said, what type of doctor sent you? What a great question. What did I say? I said GP. More than likely, she's going to need a referral to a urogyne. Not always, but if she wants to have a pessary, if she wants someone that actually knows what they're doing in terms of this. A GP is not a specialist in this area. I'm not going to broadly dog every GP, but at the same time, she deserves someone who can give her options and specializes in this. And that's what urogynes do. Urologists as well. My preference is urogynes, just because they actually study the pelvic floor in school. They're the only profession that does. Angela asked me, do I own my own farm? Does my partner help? Who else works there? Fantastic questions. She really reassured me. This is a common thing, right? She noticed I wasn't sexually active. She asked me questions about that. She told me I was in the right place. She again brought up my low back pain, wanted to tie that in chronologically. And then I love that she very much said, I have never owned a farm. Do you work 7 days a week? You guys are going to have clients who you may not know. Maybe they do CrossFit and you know nothing about that. Maybe they have a profession you know nothing about. Why should you? It's 100% okay to admit that you don't know something. And that's where curiosity factors in. And they're going to light up. Oh, I got to tell you about CrossFit. There's this jump I do. You know, it's just great. It's just great to be that honest. It does not make you seem less credible. Nancy, same level of heaviness outside of work. Do you have the same level of, yes. She asked me about what type of equipment I use. Awesome. Really starting to understand this client and what her day is like. Elizabeth, fantastic job asking me, are you comfortable talking about the bowel side of things? And then she told me why. This is going to have quite an influence on your prolapse. So she's internally, intrinsically motivating me while also giving me agency, letting me decide if I want to talk about this. And then I put that little thing out there about being afraid, and Elizabeth came back to it. She heard that, and she then reassured me and also talked to me about popping the squat in a very, very reassuring way. Love your clinical presence, Elizabeth. Alina asked me, am I limiting fluid intake because of this? Like, so practical, such a great tie-in to what I'm experiencing. And then lastly, Aisha asked the great question, how are you feeling pressure to do duties? Does anyone remember what I mean by that? Aisha, are you still here?
I was asking about when she feels the pressure from the prolapse, how it affects her ability to do her task on the farm.
That's it. Perfect. Thank you. My writing got bad at the end there, but that was awesome. Awesome question. You guys did an incredible job. I really could not be more impressed with everything. And I can't wait to see you guys in the next call. Keep up the incredible work. You know, my emails are hopefully pacing you and keeping you going. But boy, do I love it when we can get together like this. I'm already anticipating the next call. I don't think I need volunteers for the next call. I do believe it's more of a group activity. If I'm wrong about that, I do need volunteers, please consider volunteering. Although, thank you for teaching me something new. I've never done this group thing before, and it actually worked out really well, and you all played off of each other in such an incredible way. So thank you for your presence and your commitment to this work. I can't wait to see you guys next time.
Thank you. Thank you so much.